Nothing's quite like Mayo. There's so much openness, there's so much camaraderie, there's so much collaboration.
We really promote teamwork, and so our medical students are welcomed as a very important part of a medical care team.
As first-year students, we're in the halls of the hospital working alongside the physicians and attendings, and they treat you as a colleague. What's reinforced is that the focus is always the needs of the patient. The patient comes first. That's the value system that was in place at the outset of the clinic and has been maintained.
We're trying to provide students with an opportunity to develop into critical thinkers, not memorizing large amounts of information, but using information to solve clinical problems. To do this, we have really gone from a curriculum that had individual silos of biochemistry and physiology and molecular biology into a much, much more integrated curriculum.
They try to organize the course that you're in class with clinical opportunities you have. And so say you had a block on hematology, then you would be in the hematology clinic that week shadowing doctors and learning firsthand the stuff you were learning in class.
Once you have an opportunity to learn in context the clinical application of the basic science knowledge, it's retained forever.
There has been a trend in the past couple of years to move away from human tissue dissection, but our medical school has still kept it because the value of dissection is actually incomparable. We have each of these cadavers already scanned. Students can actually visualize these cadavers from a radiographic view before they actually go into doing the dissection.
They really teach you a lot about not only just what you're going to see in anatomy in the lab, but then also what you're going to see when you're in the hospital and how that relates back to anatomy. Our third day here of orientation, we're actually shadowing physicians. Right from the start of things, we're already having patient contact, which is essentially what you're going to do as a physician.
One of our goals is not to have the students feel like what they're entering is another few years of college. So we want to remind them that the goal is to have them be physicians. Within the first year, they're actually doing a full exam and visit with a clinic patient themselves.
It's really nice to get hands-on experience and actually be actively participating in patients' care versus just watching.
To learn clinical skills, you really need hands-on approaches, which is what we do in the simulation center, we do it in the hospital, and we do it by having the students see patients in the patient care setting.
The amount of responsibility we're given is significant for medical students. We're able to talk with the patients about plans, discuss physical findings with them.
Because Mayo Clinic is a referral clinic and you get patients from around the world, you're going to see a lot of really unique patients, disease pathways that maybe only 100 people have in the world.
We have a number of dual degree programs available to us.
I took a 2-year leave of absence to complete my MBA at Harvard Business School, and Mayo was incredibly supportive. They actually gave me a grant each year I was gone.
The average debt for a medical student is very significant, and not having that really opens up a lot of career options.
I can be a general pediatrician because that's what gives me a satisfying life. I'm not forced to worry about, I'm in $200,000 of debt.
You have research time built into your curriculum. One of the things that makes Mayo a great place to do research is that it's the integration between both the clinic and the labs. And so you really do have this ability to do bench-to-bedside research.
Each block has a period of 2 weeks after the block, which allows the student the flexibility and the freedom to do anything that they want.
They kind of allow you to explore, what you're interested in, what you're great at, and allow you to take that further. I've done a variety of things, from shadowing to performing research and to doing international missions.
I am volunteering at the Good Samaritan Healthcare Clinic. Everything from working in the pharmacy to caring for the patient and doing a full history and physical exam. And this is one very easy way that we can make a difference.
Mayo Clinic has clinics in Jacksonville, Florida and Scottsdale, Arizona, which gives you great opportunities to do research, see physicians, and see a different population. Nothing better than to escape for the winter for a month or so to Jacksonville or Scottsdale.
One thing that's very unique about Mayo Medical School is the contact time the students have with the faculty.
We certainly have the highest faculty-to-student ratio in the world.
They're actual clinicians who volunteer and who love to teach.
You're working with the people who are leaders in their field. To have the privilege and access to work with them is a great opportunity.
A lot of the work is actually done in small groups. The students work in teams. The professors walk around.
They really do give us more individual attention and more support than any other med school I can think of.
My mentor and I, we have a professional and a personal relationship. He kind of gives me advice on things that would make me a better clinician, a better passionate doctor.
Nobody's here to fail you. Everybody here is like, okay, let's see how you can learn. What's the best way you can learn?
Rochester is a great town. It's a small city, but it offers you everything that you need. The cost of living is very reasonable, and the quality of life is tremendous. I live a few blocks away from the medical school. Many of my friends live in this building, in addition to many retired physicians, one of which is Dr. Utes. He was on the leadership board of the Mayo Clinic. I was involved in setting up Mayo Medical School itself. They took me under their wing, and they've been wonderful, really good friends to me.
We do come from all kinds of background, different nationalities. I know every one of them by their first and last names, and definitely encourages a sense of family and community.
They're really into our well-being emotionally and physically. They try and keep our schedules pretty relaxed. They really try not to stress us out. The Dan Abraham Healthy Living Center is a place where we all get membership. It's just a really nice way to keep balanced, and Mayo's been probably more focused on that than any other med school I looked at.
Everybody works together towards a common goal and to achieve a common learning objective.
We're learning so much. It's amazing how much we learn on a daily basis.
We could really just break out and kind of discover what we wanted to do, and we weren't confined to 8 hours in the classroom every day.
I'm learning a lot and getting to see the expression on the patients' faces when we make a difference and help them out.
I'm definitely sure that I came to the right place. I'm very happy here.
It's been a great experience. To tell you the truth, I always brag about Mayo.